Good evening, everyone. My name is Okoro Johnbosco, Chukwuma. Today, I'm going to talk on vaccination and transfusion transmissible infections. One of the materials for blood transfusion is syringe and the needles, and we must ensure that the needle and the syringe are clean, and the blood to be transfused has to be screened to avoid transfusion of infected blood to the patient. The objectives of this program: number one, provide policy guidance on ensuring safe and sufficient blood supplies through effective blood screening to minimize the risk of transfusion of blood-borne infections through the route of transfusion. Number two, provide information and technical advice on the specific measures and actions. In this discussion, we're going to consider blood transfusion. And what is blood transfusion? Blood transfusion is the process of transferring blood or blood products into one's circulatory system. In doing this, it can pose a problem, or what is called transfusion transmissible infections, which is any infection that is transmissible from person to person through parenteral administration of blood or blood products. Example includes hepatitis A, B, and C, and also HIV virus. The foundation of this study can be traced in 1991 when the World Health Organization Global Program on AIDS and the then League of Red Cross and Red Crescent Societies published consensus statement on screening blood donations for infectious agents through blood transfusion. Then there have been major development in screening for transfusion transmissible infections with the identification of new infectious agents. The transfusion transmissible infections that we are going to consider in this course include hepatitis B, C, and HIV virus. The characteristics of transfusion transmissible agents include: number one, presence in blood for long periods of a time, or sometimes in higher titers. Number two, stability in blood stored at 4 degrees Celsius or lower. Number three, long incubation period before the appearance of clinical signs. Also, we can also experience mixed symptoms in the blood donor, hence not identifiable during the blood donor selection process. The number one transfusion transmissible infection to be considered here is human immunodeficiency virus. It is transmissible by the parental route. It is found in the blood and other body fluids. Once in the bloodstream, the virus primarily infects and replicates in lymphocytes. Therefore, screening donated blood for transfusion transmissible infections are recommended. The infectivity estimates for the transfusion of infected blood products are much higher, around 95%, than for other modes of HIV transmission, owing to the much larger viral dose per exposure than for other routes. So it is therefore expected to screen the blood before transfusing into the body of the patient. As a result, the screening of blood before transfusing is highly recommended. All screening strategies should employ at minimum the detection of antibody, because the identification of specific antibody is still the most reliable screening method DS should preferably also employ the detection of antigen. So the detection of antigen and antibody is specifically important for screening before transmission. The second agent to be considered is hepatitis B virus. Hepatitis B virus is transmissible by the parental route and may be found in the blood and other body fluid. Once in the bloodstream, the virus travels to the liver where it replicates in hepatocytes. So therefore, the worst screening donated blood for transfusion transmissible infections are recommended. Chronically infected individuals may either be infectious or non-infectious, and the viremia would generally be expected to be very low or absent entirely. Studies indicate that even when the hepatitis B antigen is negative, some individuals may have low level of detectable viral DNA, which will be transmitted by the blood and may cause infection in the recipient. What screening method should we employ in hepatitis B virus? The only screening method to be employed here is hepatitis B surface antigen is the prime marker used in blood screening program for hepatitis B virus. Number 2 again to be considered is hepatitis C virus. Hepatitis C virus is a member of flavivirus group, and it is an enveloped RNA virus. It is transmissible by the parental route and may be found in blood and other body fluids. Once in the bloodstream, the virus travels to the liver where it replicates in hepatocytes. Transmissibility of hepatitis C virus. But C virus is present in the bloodstream. In recent infected individuals, virus is normally present. Around 70% of chronically infected individuals are viremic. All hepatitis C virus antigen to antibody reactive donation should be considered to be at high risk of transmission of. How can we screen hepatitis C virus? The detection of hepatitis C virus RNA may be further reduce the risk of hepatitis C virus transmission through the transfusion of infected blood donated during the window period of antigen and antibody assay. That is when the results of hepatitis C virus antigen antibody assays are negative, but hepatitis C virus RNA is positive. However, any benefit is dependent upon hepatitis C virus incident and the actual number of donations that may be collected in the window period. The incident window period model and is used to assess the risk of transfusion transmitted human immunodeficiency virus and hepatitis C virus is infected. Simultaneously, detection of hepatitis C virus core antigen and anti-hepatitis C virus antibody improves the early detection of hepatitis C virus infection. The implications to public health: transfusion transmissible infections, human immunodeficiency virus, hepatitis B virus, hepatitis C virus, and syphilis are among the greatest threats to blood safety and pose a serious public health problem. Significant high prevalence of transfusion transmissible infections was identified from blood donors and they remain to be the greatest threat to blood safety. So comprehensive screening of donors' blood for HIV, HBC, HCV, and syphilis using standard method is highly recommended to ensure the safety of blood recipients. Conclusion: the rate of transfusion transmissible infection can be reduced by the development of practical and organized system of mandatory blood screening according to World Health Organization. Reference, it can be found in internet. That's my source. Thank you and God bless you.